Good morning. Welcome and thank you for joining us for our Northern Light Health, Good Health is Good Business Zoom conference. We will start off with an update on COVID-19, followed by an in-depth look at obesity and weight management from all angles. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Shira Pattison, a patient who will share her personal story. Sarah Stanton, a program manager at Northern Light Surgical Weight Loss and Medical Weight Management. Dr. Aja Kronholm, a psychologist at Northern Light Behavioral Medicine. Dr. Matt Sharbo, a bariatric surgeon at Northern Light Surgical Weight Loss. Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Senior Physician Executive at COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19. Dr. Jarvis?
Well, thank you, Ed. So I want to use this map to kind of show where we are right now in the United States and kind of in Maine as well. So if we look at the upper left-hand corner, that's what the map looked like for transmission across the United States back on June 30th. And where we were just towards the end of last week, you can see there's been some little bit of shift. But then if we look at what the predictive model is for 2 weeks from now, we can see that we have some areas of the country which are starting to turn from that yellow-orange to a more darker red. And that's because we're starting to see more community spread out there in particular areas due to some specific variants. The next slide will show us a little bit about Maine. So if we look here in Maine, and the graph that's on the left, or the graphic that's on the left, shows us where we are for over the average of the last 30 days of new cases in the state of Maine. And you can see that it's very varied. There are some areas where we have very, very low prevalence of disease, and a few areas like up around Aroostook County and in Cumberland County, where we're starting to see some more spread of disease. If we look at the CDC's risk level for communities by county, you see that almost the entire state of Maine remains in the low category, with only Aroostook County being in the medium category. I remind people that the difference between these two is that the graphic on the left really talks about transmission, how much disease is actually out there. The one on the right talks about how that disease is affecting particularly healthcare agencies and the ability for hospitals to care for patients. So while it's good news that we are in the low level, we must remember that in Maine, where we start to see in the summertime admissions to hospitals, not based on things like coronavirus, but due to tourism and increases there, the CDC does not calculate that into their factors for risk. So it may actually be that our risk to our communities is a little bit higher than what the CDC is currently projecting. Next slide, please. This is just that rolling average that I've shown in the past that just basically shows where we are in the pandemic. So what I want to point out once again is if we look at where we are at the very, very right-hand side of this graphic is higher than where we were exactly 1 year ago. So last year we were talking about having a very pleasant summer, and then unfortunately the Delta variant hit, followed by the Omicron, and you can see what happened in that intervening period. And we are not as low in amount of cases out in the state of Maine as we were back then. Still much better than we were for most of the pandemic, and that is good news for us, but it should always come with that word of caution. There is plenty of spread of coronavirus out in our communities right now. Next slide, please. I want to give a quick update to vaccines. Boosters are now recommended for children who are ages 5 and above, and that should be a messenger RNA vaccine. And so that's good news. There is now a second booster that is recommended for people who are over age 50 and above, and for 12 and older who are immunocompromised, and that should always be an mRNA vaccine. There is talk at the federal level that maybe they will expand that recommendation to a second booster recommended for anyone over the age of 18. And some good news is that the primary series is now authorized for children who are 6 months and older. So that means just about everybody in our population who wants to be vaccinated can be vaccinated. And that's welcome news, particularly as we look at having the school year start in just a few months. Next slide, please. I do want to talk about some concerning trends. The biggest concern that I have right now is around the Omicron subvariants, particularly the BA4 and BA5 subvariants. They are now the dominant strains in the United States and Europe. Particularly the BA5 is of concern because it is incredibly infectious. And not only is it more infectious than we've seen with any other variant, it may be more infectious than any other virus that we have ever had since we've been tracking how viruses spread. So measles currently is considered the most infectious virus out there, and BA5 might overcome it as the #1. The other concerning thing is that it can evade immunity from both vaccines and prior infection. However, people who have been vaccinated or had recent prior infection are protected against severe disease, particularly if they are fully vaccinated, including all recommended booster shots. That should say boosters, not vaccines. I apologize for that. There is also something that's on the horizon that is concerning as well, and that's variant BA2.75. When we had variant BA2 as our dominant strain here in Maine, it did cause significant disease. This subvariant of that variant has been shown to be more infectious than it, and it bears watching because it's causing some case counts to rise in Asia, and we do know that there have been some isolated cases of this particular subvariant here in the United States. Not any confirmed in Maine as of the last time that I checked the data, but it just bears watching yet another mutation that is more infectious than our prior mutations. Next slide. This is where you can easily go ahead to schedule a vaccine, your booster shot, or a flu shot as we start to talk about flu shots coming up in the next couple of months. Next slide, please. And then I'll turn it back over to Ed.
Well, thanks, Jim. Before you go, I have a question for you. You know, we're all out in the community, and for the most part, my conclusion is I think the general public sees us as clear sailing at this point. And what's your professional view on, are we clear sailing for the foreseeable future?
Yeah, I wish I could say that was where I am at. A couple of weeks ago, I did say that I thought we would have a very nice summer, and I still think that will be the case. But I do think that there are some warning signs. Maine typically trails behind the rest of the nation when it comes to respiratory illnesses, and we're seeing respiratory illnesses of coronavirus increase across the United States. And so that's an important thing to remember. Plus, we have summer travel, and so we know lots of people travel into Maine, so they could be coming from a highly endemic area and bringing COVID-19 to us. But we also know Mainers travel elsewhere, and my guidance for those who are traveling elsewhere is check the CDC guidance on the community that you're going to. And I always recommend look at the county level, not the state level, because oftentimes state populations dilute out the actual factor, and you may be traveling to an area where the state's prevalence is low, but the county that you're traveling to is high. I still recommend that anybody who's at high risk for severe disease wear masks when they're in an indoor setting, particularly if there's going to be a lot of people in that particular facility, or they're going to be there for a long period of time. And I caution my patients about that as well. For other healthy people, I think it's still probably okay to follow the CDC's guidance in most of our communities, where right now community transmission or community risk is low. And if you choose not to wear a mask, that's probably appropriate. But if you're living with somebody who's at high risk, I'd wear the mask.
So BA.5 might prove to be the most infectious transmissible virus that we've ever seen, beyond even measles, you were saying. And then on top of that, it's now dominant in the US as well as in Europe, and we have seen some hospitalizations go up around the world related to it. So would you conclude like now's not the time to let down our guard?
Yeah, I don't think it's ever going to be the time for us to let down our guard,
Oh
whether
gosh.
we're dealing with COVID-19 or some other virus that we haven't yet found. I think we always need to be in tune that there are definitely going to be threats to us.
Mm. I think I'm going to have to get you a new crystal ball, Jim, just so it's more optimistic. Okay,
It's
well,
a little
thanks so
cloudy
much.
right now,
It
but I
sure
think it's still
is.
predictive.
It sure is. Well, thank you very much. That's a lot of useful information. Now we will take a deep dive into weight management. While this is very much a personal issue, it is also a business issue. We've all heard that obesity is an epidemic, especially in the United States. Obesity is clinically defined as body mass index greater than 30. By this definition, over 1 in 3 American adults are considered obese. According to the Journal of Health Economics, obesity-related spend accounts for nearly 20% of US medical costs. Individuals with obesity spend 42% more on medical costs. Work-related injuries of employees with obesity are 25% higher, with claims filed twice as often. The costs of medical claims are 7 times that of healthy weight employees. Employees with obesity are absent 10 times more days for injury or illness. Workers' compensation insurance premiums are the tip of the cost iceberg, with productivity impairment and absenteeism costs that are indirect and below the surface. A study reported in the Journal of Occupational and Environmental Medicine looked at 39,000 US workers over a 7-year period. Well, this study demonstrated a correlation between average direct medical costs and severity of obesity. So that's a correlation, not necessarily cause. In this study, normal weight persons cost $4,500 per person per year, and range to the highest obesity severity group costing $19,000 per person per year. The research has found the same relationships with absenteeism and disability costs. So looking at these findings from the correlation studies and comparing to early causal studies, a picture is emerging that the data presented significantly underestimates the costs caused directly and indirectly by obesity. Now that the stage has been set to appreciate the cost impact obesity has on business, we'll spend most of our time today considering what can be done about it. Shira Pattison will share her story. Thanks for joining us today, Shira. All yours.
Thank you very much. I'm happy to be here today and to share with you all. Many of you may be able to relate to my story, and you likely have folks that you interact with in your family group, your friend group, or your coworker group that could relate as well. So I've had a lifelong struggle with obesity. And there's a family history of obesity in my family. And food is central to so many of our lives. It's how we celebrate, it's how we grieve, it's how, it's everywhere. I remember being 11 years old and starting to dread the scale. They'd line us up at the nurse's office. We'd stand in line, we'd wait to get our height and our weight, and I'd be so nervous as to what that number is going to be. And I knew it would be higher than my friends and all of that. I was very conscious of it from a young age. And I remember my summer camp physical, probably that same year, and the doctor saying I needed to lose 30 pounds. And I was so overwhelmed by that. And I remember talking with my mom about that and thinking, how am I ever going to lose 30 pounds? And this is, as a kid. And, I had well-meaning family and friends along the way trying to help motivate me as a child. I remember one friend's mom, who my friend was also overweight, and her, challenging us one summer, and whoever could lose the most weight, she'd give us $100 or something. And so, all these little tricks along the way. And I would read every article I could. I'd read every book I could. I remember spending birthday or Christmas money on, the latest diet book at the local bookstore. And I probably tried every diet throughout the course of my adolescence and a young adulthood and into my adulthood. Everything from Weight Watchers, even Deal a Meal, if anybody remembers that, intermittent fasting, things like that. And the medical weight management program with Northern Light. And I definitely found success. I mean, I've probably lost 100 pounds more than once in my life and then gained weight back. And then eventually I went on to have children. And of course, that impacts us as well. And I started to hear about weight loss surgery. I had some friends that had had success with it, lots of people that were close to me, people that I knew professionally that had had success. And so I started noticing that. And I started thinking about, is this a good match for me? So probably in around 2017, I started to look into it a little bit. I participated in an informational session. I started to learn about the program. And I remember at the time thinking like, wow, there's a lot more to this than I thought. At that time, I thought you just go in for the surgery. I didn't even know there were different types of surgery you could have, and all the work and all the changes you needed to make leading up to that. So ultimately at that time, I decided that it wasn't for me. I had 2 really young kids. I felt like I can do this myself. I'm going to take another chance at this. And so I kind of went on, but it was always in the back of my mind that this was an option. And then fast forward to the summer of 2020, and that's the before picture you see on the slide, was sometime around there. And I had again tried Weight Watchers and intermittent fasting and probably lost some weight. But I was tired, and I knew that there was more to my life than to constantly be thinking about my weight. And the potential health implications were really important to me because in my family, there's a history of cancer, there's heart disease, diabetes, all of these things that I had avoided until now. By all accounts, I was pretty healthy. I didn't have high blood pressure, but I was obese. And I was worried about what the future might hold given that family history. And more importantly, I had serious concerns about COVID. And because at that point we were at home, we were in lockdown, or, we were all at home, but you kept hearing about how obesity, people that were obese and got COVID had much more chance of getting seriously ill or dying from COVID. And I was at home with my 2 young children and my husband, and I was really legitimately scared about what that would mean for me. So I decided it was time to look more seriously back into the weight loss surgery. So in October 2020, I did the online seminar and sent in the paperwork for the surgical weight loss program. And I attended my first online support group, and it was great. I remember I learned so much. I heard a patient story of somebody who had just had surgery 2 weeks before, and she was doing great. And I remembered feeling like when I got the information back, I was told it's going to be at least 6 months. Here are the steps you need to take. You need to go to the nutritionist this many times. You need to see the counselor so you can have an assessment of your readiness. There were lots of different steps along the way. And I remember thinking 6 months is so long, like I want to just do this now. And I am so glad that the program has all these milestones along the way that they want you to meet. The Northern Light Health wants you to be ready for this surgery because it's a tool. You need to be able to put the pieces in place to have success over the long term. And I felt very prepared for that. And learning about all the changes I would have to make. So you have to change your nutrition. You have to focus on protein. You really need to make sure you're fueling your body. A lot of people don't realize about the vitamins and supplements. You need to make sure you're getting all the nutrition you need. And so you have to take vitamins every day for the rest of your life. Oftentimes a calcium supplement, sometimes an iron supplement. I mean, none of this is like a deal breaker, but it was a change for me for sure. There are things you need to do, like eat more slowly. You need to eliminate carbonation and straws, and really also set up your support networks. And so this was all a process. But even when I completed the requirements, I wasn't 100% sure I was going to go through with the surgery. I was a little bit nervous. I wasn't sure, I was like, maybe I can still do it. And when I met with my surgeon, Dr. Michelle Toder was my surgeon. And once I met with her, I knew I was ready. She answered my questions. She gave it to me straight. She told me what I needed to do to be successful and what I needed to not do to be successful. She answered my questions, and I really felt completely comfortable and very excited to move forward. Before surgery, you have to have a 2-week liquid diet. Some people dread that. I found a lot of clarity in it. At first, it was a challenge. It was a big shift, but it was something that I knew was getting me ready for the surgery. It was preparing my body, and it was shrinking my liver. And that's an important piece so the surgeons can safely access your stomach. And, but I just found this strange sense of clarity that I didn't expect to find, and it was actually really great. So finally, in April 2021, I had the surgery. It went great. I had no complications. My goal was to be up and walking. That's what they encourage you to do. They want you to be moving and just keeping moving. And so I felt like I had pretty smooth sailing. Things were really great. And I had a very supportive environment. My family, my spouse, my coworkers. When I came back to work, we were taking walking lunches, all those things that really helped. I even got balloons my first day back to work. It's really great, to have an environment of support. And, what's been important to me is physical movement, making sure I'm focused on my nutrition. I'm far from perfect. There are things I'm learning along the way, and things I need to just check myself. But I'm very excited that so far I've lost 81 pounds, and that second picture is just from my son's last day of school this June. And I'm thrilled. I have more energy. I'm physically stronger. I'm happier. I want to do things. I enjoy clothes shopping. I've been very open about my surgery from the beginning because I don't feel like it's anything to be ashamed of, but it's also something people, they don't fully understand until they learn about it. But it's a tool that can help me manage my obesity and prevent future health problems, which is very important to me. I'm a mom and a wife, but I'm also a CEO by day. And so I hope that I can be a role model for my family and my friends and my coworkers and even my fellow leaders. So I'm happy to chat with you offline about this anytime. But thank you for the chance to share my story.
Wow. Thanks, Shira, so much for sharing such level of detail with all of us. Very impactful. You made me think of a couple of things. First off, deal a meal. I actually know that. That's based on a 1,200 calorie American Diabetic Association diet, which I recommended to my patients in the past. So yeah, you're right. The deal meal made it fun though. The other thing you made me think about is a coworker saying to me, COVID-19 perhaps is the greatest weight management program ever invented. And I think you shared with us that COVID-19 actually made you think about it with, obesity being significantly correlated with poor outcomes getting COVID-19. So thanks for sharing all that information. Sarah Stanton is our next speaker. Sarah will help us understand holistic weight loss. Sarah?
Hi, good morning. Thank you. Shira, thank you for sharing your story. It's a great example of how our holistic program encompasses physical health as well as mental and emotional health. We do this by including physicians and surgeons in our program, and also registered dietitians who work closely with individuals to support healthy eating habits and also behavior changes. We also have program psychologists who work with patients to identify potential challenges that they may have either before or after surgery, and also reinforcing some of those behavior changes. We have physical therapists who are available to help with adaptive techniques for those who may need it when it comes to increasing physical activity. And also the availability of other specialists to work up and treat conditions as needed. While weight loss surgery is a valuable tool, it is just that, it's a tool. It has to be used in conjunction with diet, exercise, and consistent behavior modification so that that long-term weight loss is successful. So I've mentioned a couple times already about behavior change, and Shira also talked about it. But what exactly are these changes? What are some of the things that people are expected to do? When coming through the program, one of the big things is to eat slowly. We really want people to slow down their meals. It should take at least 30 minutes to eat a meal. And this is a big change for a lot of people. But the reality is it takes at least 20 minutes for your stomach to signal your brain that you're full. So taking that time to really slow down and let your stomach, make that signal. This is also important for after surgery because your portions are going to be very small, a lot smaller than what you're used to, and it will be really easy to eat too fast. So really getting in that habit of slowing down and making your meals last a while. Along these same lines is chewing your food really well. Chew, chew, chew. You want your food to be chewed to a liquid consistency. And doing that is really going to help you slow down your eating and help you to get to that 30 minutes. Fluids also need to be avoided around mealtime. So we want you to avoid fluids 30 minutes before and 30 minutes after a meal. And this is also a big change for a lot of people and something that's can take some time to get used to. Again, chewing your food to a liquid consistency is going to help when you don't have any fluids to wash it down. One of the other behaviors is establishing an exercise routine. It doesn't have to be anything crazy, but we want people to kind of be in that habit of doing something, some sort of physical activity most days out of the week. So really nailing that down. And these are some of the changes that we ask people to make. And really it's because after surgery, these are going to be really important as well. So using the time prior to surgery to really make these habits is going to be really important. It's also going to make you be more successful after surgery if you already have these habits in place. So working on all these things before surgery, and then you have surgery, and then what? We have a lot of support after surgery. We don't just do surgery and then say see you later. After surgery, you're going to see your dietitian quite frequently for the first 6 months. You're going to check in with them for progressing your diet, making sure that you're getting enough fluids, enough protein. We're also going to have you check in with a psychologist at 3 months after surgery and 9 months after surgery, just to see how things are going, if you're struggling with anything. And both the dietitian and the psychologist are available as needed. So even though we have scheduled appointments, if you want to see them any other time for some additional support, certainly it's available. All people need to do is give us a call and we can get those appointments set up. At 6 months after surgery and a year after surgery, we're going to have you check in with our bariatrician. She is also leads our medical weight management program. She's a board certified obesity medicine specialist, and she helps really follow up with lab work and checking in on that. And these yearly follow-ups with the bariatrician and with a dietitian, it all really helps you to be accountable, and it really helps in the long-term success. So our medical weight management program is another great program that we offer. Sometimes surgery, someone doesn't want to quite do surgery, but they really, would like some help with losing some weight. This program is led by our bariatrician as well as some nurse practitioners, and they really are going to work with an individual on a lot of those same things that are worked on before surgery. So nutrition, physical activity, behavior modification. They're going to work with you one-on-one to meet those weight loss goals. And really the goal is to have successful long-term weight loss, not getting stuck in that cycle of doing a diet and then gaining the weight back. We want you to, be successful and not have the weight come back. So really working with an individual to have a diet plan, a nutrition plan that's low in calorie, but it can also be low in fat, low in carb, Mediterranean style diet. If you have some certain things that you're avoiding, diet restrictions, that sort of thing. We're going to really work to make that an individualized plan. And also working on increasing physical activity and some of those, finding something that you can do that you enjoy. We want physical activity to be something enjoyable. We don't want you to dread it every day. And then also just some behavior modification things. Dietitians and physical therapists and the psychologists are also available to people who are in the medical weight management program for extra support when needed. And also, I did talk about the support after surgery. Northern Light Surgical Weight Loss is recognized as a center of excellence by the American Society for Metabolic and Bariatric Surgery. That was from 2005 to 2009, and since 2009, our program has been accredited through the American College of Surgeons as a metabolic and bariatric surgery accreditation and quality improvement program. That's a mouthful, but what does it all mean? It means that our program meets the essential criteria that ensures we're fully capable of supporting a bariatric weight loss surgery care program, and that our institutional performance meets the requirements outlined by the American College of Surgeons. So in order to receive this designation, our center undergoes a site visit every 3 years by an experienced bariatric surgeon who comes in and reviews our structure, our facility and equipment resources, our processes and policies, personnel and service resources, including all the specialists that we have available when needed, data surveillance, and quality data, including our yearly quality improvement initiatives. Northern Light EMMC is preferred status as a center of excellence with many insurance companies, and these include Harvard Pilgrim, Aetna, Optum, Cigna, and Anthem Blue Cross Blue Shield.
Well, thanks, Sarah. I've really come to appreciate that holistic weight management is really a journey, and there's tools to be used along the way. I also appreciate why our program is a center of excellence. That's really awesome. I have a takeaway from your talk today. I'll admit up front that my wife has told me to slow down eating, and now that Sarah Stanton has put it out there, I'm going to tell her I'm going to follow the advice, and my goal will be to increase my meal time by 25 minutes to get to the 30. I certainly eat too fast, so thanks, Sarah. Dr. Aja Kronholm is our next speaker. She'll address the support people need through their weight management journey. Dr. Kronholm?
Hello. Well, we know that involving mental health in the surgical weight loss process is associated with best practice guidelines through the American Society of Metabolic and Bariatric Surgery. And there's really widespread recognition that psychosocial factors can impact surgery outcomes, but that also surgery outcomes can sometimes have unintended consequences for those psychosocial factors. So to that end, one of our first contacts with patients happen when they participate in our pre-surgery psychological consultation. And sometimes they might be a little bit apprehensive about that. They might worry that that is a barrier for them to be able to move forward to surgery. Well, we want to let them know that that's really a decision that they make with the surgeon. And our job is to help optimize their outcomes and help them figure out how surgery fits in with their lifestyle. So the purpose of our consultation is to help patients identify any risk factors or challenges that might come up for them before or after surgery, and help them develop a plan to manage and address those issues. We want to make sure that patients understand what they're getting into. What are some of the potential risks of surgery, such as developing food intolerance or excess skin. We want to make sure that patients have realistic expectations of how much weight they're going to lose and what may or may not change depending on that weight loss. Our consultation provides information to other members of the treatment team that might be relevant to the patient care. And it's our opportunity to establish a working relationship with the patient. We want to be able to be a long-term resource for them, especially since research shows that ongoing contact with the treatment team leads to better outcomes. Patients are also sometimes a little bit apprehensive about, well, what are you going to ask me during this evaluation? And we really look at domains that might be either that might impact their surgery or might be impacted by their surgery. In the mental health domain, we would be looking at, is their mental health diagnosis impacting their ability to stay on track with healthy changes? Surgery can definitely be a stressor, so we want to make sure that they have the coping strategies to be able to cope with that stress after the surgery. And if there are any concerns around that, we would offer some recommendations for how to better manage their mental health diagnosis. Socially, it is so hard if your significant other is sitting across the table from you eating your most favorite foods that you might be trying to avoid. So we might come up with a plan for how to address that temptation when that comes up. In terms of educational history, we're looking for differences in learning style that can impact a patient's ability to learn information from the treatment team or to follow recommendations. So we want to make sure that we're working with their learning style and conveying that information to them. Really relevant for our audience today. We ask a lot of questions about work. We spend a big chunk of our day in the work environment, and we're looking at things like, does the patient have the ability to have a meal over the course of their day? Are they able to stay hydrated? Are there any specific situations that might be tough to navigate? That coworker that always has the candy dish on their desk, right, that they have to pass every time that they go to the copier, or maybe there's a monthly pizza party that might be a little bit tough to get through. So we talk about some strategies and how to cope with that. We also look at, is there anything about their work schedule or work requirements that might get in the way of their time to be able to engage in self-care and try to problem solve around those difficulties. With regards to medical history, we look at how adjustment has gone with any previous surgical procedures. Were there any challenges in terms of following after surgery recommendations? Or Shira mentioned having to take supplements in the long term. So we want to look at, were there any difficulties with remembering to take medications or refilling medications? Because we want to come up with a plan to help with that if that's been a concern in the past. Weight management and dieting history. What has worked for the patient in the past? What has not worked? How can we use that information to inform their approach going forward and hopefully get them the best outcomes possible? Is there any history of an eating disorder or any concerns like that that would need to be addressed? How are they doing with the current changes? As we've been hearing, those are not easy changes to make. If you are a fast eater, as I think we've heard throughout this session so far, it's really hard to slow down your eating. You can feel like you're kind of moving backwards. So we might talk to patients about some strategies to help with that. And if I can have the next slide. So to support patients, we've got a variety of services available. Some of them can be pre-surgery. So some of the things that might need to change before surgery, we offer smoking cessation is one opportunity, helping patients develop other strategies so that they're not eating for emotional reasons. As Sarah mentioned, we do the 3 and 9 month follow-ups after surgery, as well as at request for any problems that the patient might be having after surgery. We check in with things like their mood, how they're doing with all the different changes, and if there are any unhealthy habits that might be creeping back in. Are there any situations that have come up that were a surprise for them that may be a little bit harder to navigate, and helping them and supporting them with that? One of our psychologists facilitates the aftercare group, so that gives patients an opportunity to support each other in the weight loss journey and things that have worked for each other or challenges that they've had. And it also allows our psychologist as facilitator to offer some guidance and strategies that might help in terms of staying on track in the long term. We are available in the long term. So sometimes we have folks coming back after maybe 10 or 15 years out from surgery, where maybe they had some life changes, new baby, new job, new life circumstances, and they're looking for some help to get back on track. And we're certainly available for that as well. We specifically work with folks that have medical conditions or help coping with medical conditions. So if someone's coming back with general mental health issues that maybe aren't related to weight management or their surgery, we help connect them to general mental health providers to address those needs. The services we provide are evidence-based and short-term. We generally meet with folks for about 6 to 12 sessions. And the therapy that we provide is cognitive behavioral therapy, mindfulness approaches, and dialectical behavioral therapy. Basically, those approaches help people identify and understand their behaviors and better be able to cope with any challenges that come up with staying on track, either removing some of those triggers or difficulties or learning to cope with them more effectively. So our department is really available to patients throughout their weight loss journey.
So thanks, Sasha. It sure sounds like behavioral and mental health support is on par with the physical aspects of weight management in terms of what's important. So thanks so much for all that information. Dr. Matt Sharbo is our next speaker. He will talk about bariatric surgery. Dr. Sharbo?
Hi there. Weight loss surgery is more about improving patients' quality of life than necessarily just decreasing their weight. And we find that when we're able to improve many of the obesity-related conditions that you can see on the left, people's quality of life improves significantly. The first one we have listed here is diabetes. Diabetes is a condition where the blood sugar can be elevated and difficult to regulate. Patients often are checking their blood sugars multiple times a day and then dosing their insulin appropriately to keep their cells regulated. Diabetes is a condition that after weight loss surgery can see up to 75% resolution at just 1 year. So weight loss surgery is really the only way to cure diabetes. And for some patients that don't have a full cure, their improvement is usually very significant, where they're sometimes on many units of insulin, and that improves to just a few units per day. And that significantly improves patients' quality of life. Obstructive sleep apnea is a condition where patients have difficulty sleeping at night. That leads to somnolence during the day, and it leads to lost productivity. Oftentimes, these patients have to wear a mask at night to help them sleep. We know after weight loss surgery that there's a greater than 95% resolution of sleep apnea. People can sleep better at night, they're more well rested during the day, and they're more productive at work and in their life, and their quality of life improves significantly. High blood pressure or hypertension is very common in the population of patients that have weight that is higher. Oftentimes that comes with taking many different medications. And this is something that I get great pride of, but after a surgery that takes 1 hour to 2 hours, we often send people home on no blood pressure medication. And blood pressure readings normalize within just a few weeks after weight loss surgery. Hyperlipidemia is also known as high cholesterol, is another condition that improves extremely quickly after weight loss surgery. And we often send people home after just 1 night in the hospital without any cholesterol medications again. Arthritis is very prevalent in the population of patients that have weight that's higher. It ends up ending in somewhat of a vicious cycle where when patients have higher weight, there's more pressure on the joints, there's more knee pain, there's less exercise, and that leads to weight gain. Oftentimes, we see patients that come to us that say, I need my knee replaced or my hip replaced, but I can't get it done because the orthopedic surgeon has told me that there's high complications in an obese population undergoing joint replacement. And it's absolutely true. And we're able to break that cycle with weight loss surgery, and the quality of life that you can provide some patients after decreasing the pressure on their joints is quite significant. Acid reflux is a condition that is highly correlated with obesity. As the weight's higher in the abdomen, more acid gets pressed up into the esophagus, and that can cause acid reflux. During gastric bypass surgery, we reroute the intestines and disconnect the part of the stomach that creates acid, so there's no longer acid going into the esophagus. And the resolution of reflux after weight loss surgery is significant. There's some other cancers and fatty liver disease that are highly correlated with obesity. And when you can lower patients' weight, those risk factors in the long term improve significantly. What should patients expect after weight loss surgery? Most people spend 1 night in the hospital and are discharged the next day. We get our patients up and out of bed almost immediately after surgery, where they're walking the halls just a few hours later. We have a highly trained nursing team that knows that that is very important for post-operative recovery. After surgery, and with the advent of more minimally invasive and robotic surgeries, smaller incisions are leading to less post-operative pain, and people are more commonly leaving the hospital without narcotic pain medication altogether. We often send people home with just Tylenol. And to me, that's extremely remarkable Because if you think about how these surgeries were done 20, 30 years ago, that certainly wasn't the case. For patients who work at a desk job, I tell all my patients that on average, most everybody is back to work at 2 weeks after surgery. Lifelong, as Sarah alluded to, patients will follow up with the weight loss program, and they'll make those dietary, exercise, and lifestyle change to have excellent success after weight loss surgery. Eastern Maine Medical Center has always been on the forefront of surgical innovation. Northern Light Eastern Maine Medical Center was actually the first robotic bariatric teaching center in the entire world. That's a remarkable fact. We've been teaching weight loss surgery here on the robotic platforms to surgeons from the United States and from all over the world. A question I get in the office almost every day is, what exactly is robotic surgery? Is there a special robot operating on me? And I tell everybody no, but the robot is a special computer interface between myself and the patient that allows us better visualization, smaller incisions, more precision, which leads to less bleeding and less post-operative pain. This is something I'm very proud of, but most recently, Northern Light Eastern Maine Medical Center received the state's first Center of Excellence in Robotic Surgery by the Surgical Review Corporation. Long-term life changes after weight loss surgery, and this is where I probably get some of the most benefit or the most personal satisfaction about my job, is some of the day-to-day interactions that I see with patients who come back to me and tell me after just 2 weeks, they have more energy, less pain, and they're doing some of the things that they never imagined possible, such as water skiing, hiking Mount Katahdin, taking their first CrossFit class, flying on a plane without an extender, running the Millinocket Half Marathon, or traveling and visiting Disney World. But most commonly, I hear in the office, patients come back and say, I'm finally able to play with my kids or grandkids without having pain.
Well, thank you, Matt, for all of that. While the other panelists join us on video for questions and answers here, I'd like to ask you a couple of questions, Matt. First, is bariatric surgery for everyone?
It's not. There's always going to be a small percentage of patients that don't qualify for surgery. But as long as the BMI criteria are met, there's a significant population of patients that will qualify. In America, with the obesity epidemic, only about 1% of patients who qualify for weight loss surgery actually get it. Now think of that number if you were to think about heart surgery and only treat about 1% of those patients. It's a significantly underrepresented patient population.
Boy, that's an interesting way to look at it. A follow-up question. So those small incisions you're talking about, that's minimally invasive robotic procedures that you're doing. Is that available to most patients who are eligible for bariatric surgery?
Yep, both my partner and I who do these surgeries almost exclusively do robotic and minimally invasive surgery. And so that means greater than 99% of our patients every year undergo surgery with just a few small incisions, which I tell everyone is about the size of your tiny fingernail.
Wow, that's pretty amazing. So a quick follow-up question. So how successful are people at losing and maintaining the weight loss after surgery?
Very successful, and it's important that we have such a strong program so they have the support for the lifelong journey that they're going to take. After weight loss surgery, there's a very high percentage of patients that lose more than 50% of their excess weight at 1 year and are able to keep that off in the long term.
Wow, that's really amazing. Well, thanks for all that information. I'm going to shift gears. Shira, I have a question for you. Does your weight management success breed success in other areas of your life? Just kind of a very interesting part of all this.
I would say yes. I think it is because, as I mentioned, it's something that I was spending so much energy and time thinking about. And it's not that I don't think about my weight or trying to stay on track or anything like that anymore, but it's so much less a part of my chatter in my head all the time, and it's freed up space for other things. I think it's helped me with my stress management. It's helped me. I think I'm a better mom, a better wife. I'm better at my job. And I've wanted to try new things. So Dr. Sharbo mentions hiking Mount Katahdin. That's been a long-term goal of mine. I haven't done it yet, but it's something that I feel like now I can do, and so I think it certainly has, it's helped with my confidence as well. I've always had a visible position in my professional life, and now I'm so much more confident when I have to go out and meet new people or speak in public and things like that. So I'd say yes.
Isn't that cool? So thanks so much for that info. I have another question for you, Dr. Sharbo. If you have had surgery, but have gained some back, is there a revision surgery that should be considered?
We certainly do revisional operations, and that's something that you'll want to talk to your primary care physician and get a referral back to the weight loss program. And that's something we can certainly take a look at, but we certainly look at why it happened. Is there something surgically to fix? Is there something diet, exercise, or lifestyle? So it's a complicated question, but certainly something we offer.
So the surgeries have evolved over time, the bariatric surgeries that are available to everyone. And like many things in medicine, it's becoming progressively more and more sophisticated. Is there like sort of the old surgical techniques that had more modest success that can be revised? Is that how the thinking goes?
Yep. If you look at the history of bariatric surgery, it's been around for many, many years. And through that course, we have seen many different iterations of operations, some of them less successful than they are today. Certainly some historical operations that I still see day to day that we recommend revising to what is the current standard of weight loss procedures.
Great. So the next step would be to consult with the primary care physician, get their input and perhaps a referral for a second opinion from a surgeon.
Yes, exactly.
Okay, great. That's very helpful. Question for you, Sarah. How do you know when it is the right time to move from medical weight management to surgical weight loss? Like, where's the magic in that?
That's a great question. So really, if someone's been working with the medical weight management team and they've really been putting in that work to get those three big things, the nutrition, the physical activity, and the behavior changes, if they've been doing that and they just maybe aren't quite meeting the goals that they were trying to get to, or maybe they're still really feeling hungry, that's when the team will maybe start introducing some different ideas, like maybe adding some weight loss medications, maybe talking about surgery, and kind of discussing the pros and cons of those, and really answering any questions if there was any misconceptions about one or the other, and just presenting those as other possible options if they'd like to explore, and if they decide they want to maybe pursue surgery, then getting them on that track.
Okay, that's very helpful. I'm going to actually go back to Shira for a similar type of question. And you shared so much information for us, but I'm interested in probing a little bit more into, tell us about that time when you said, okay, it's now time to go from medical weight management to surgical weight loss. How'd that work for you?
Well, I definitely had a little bit of a gap in between. I had been doing the medical weight management, and then I had a little bit of a gap when I had stopped seeing them. I was still practicing the tools that I had learned and things like that, but I just had more time to think about it, and I think I was just paying more attention. As I had said, I had met a lot of people. I knew a lot of people who had had success with surgery. I kept seeing people I knew that were having success, and it just, when you see something, like you see a red car and then you see a red car everywhere, I felt like I just kept seeing, and I was like, I just want to look into this a little bit more. And I do think a lot of it did have to do with that time at home and reflecting, and COVID, and just, and I just knew I had done so much in my life to that point. It wasn't that the medical weight management didn't work. It just was, it wasn't, I needed a different tool. And I think it just was compounded over time and learning and all of that.
Yeah, I'm kind of drawing the conclusion that it is very much a personal decision. There's no like magic time to flip this to that. And you have to go through the journey, I guess, in your own individual way. Yeah, thanks
Yeah.
for that. I'm going to actually follow up, Ajan, a similar type of thinking. So, and keep in mind, from our audience perspective, um, in your experience professionally, how much of a psychological burden is obesity for people? I know that's like a one size fits all, and that's probably not appropriate, but give us some insight to what you've picked up from people along the way.
I think definitely it's a considerable burden that individuals have. I've definitely had people identify that when they started to gain weight was the time that they started to get depressed or more anxious. In terms of a work environment, that can manifest in having a harder time doing group activities or outings. Any sort of team building kinds of things can be a little bit more lead to more self-consciousness in those situations. And then certainly with any existing mental health problems, the added stress that can come with all the things that we've been talking about, or the costs of obesity, can also contribute.
Yeah, so quick follow-up on that. Do you see a change in people's personality and behaviors with successful weight management?
Absolutely. I love doing the 3 and 9 month follow-ups. It's so exciting. People's excitement is contagious when they come in and they've met their goals. They're able to do some of those things that they haven't done before, and they just have so much energy and motivation and enthusiasm. And sometimes it's little wins, like it's easier to tie a shoe, and sometimes it's major things like being able to get on a plane to do a cross-country trip to see grandkids, for example, for developmental milestones. So I definitely see a lot more energy and confidence come out of people. And some people will say that that's the person that they always were inside, and that the weight was kind of covering that up.
Isn't that interesting, huh? It is life-changing. Matt, this question is for you. So I think I would be remiss without asking, what are the possible complications from the surgery, and how, I don't want surgery for nothing. There's problems when you have surgery. So what are the complications, and how often do you see them?
Robotic bariatric surgery is extremely safe these days, but with any surgery, there's always a small chance for complications. The two that come to mind most frequently are bleeding or infection. Those are both very low risk sorts of stuff, and it's less than 1 in 100 have those problems. Something that can happen when you're doing a stapled bariatric procedure is that there's a leak somewhere along a staple line. That's less than 1 in 1,000, and we certainly do not see that very often. And lastly, with any surgical operation, there's always a small chance of death. That's extremely rare and is less than 1 in 1,000 or 1 in 2,000 for these operations.
Great. And then what about in the past, we heard about dumping syndrome, where people like can hold any of their nutrition. Where's that fit into today's methodologies?
Dumping syndrome is something that can happen after gastric bypass surgery. When we eat, food can go through the new connection too quickly. It sucks a lot of water in to the small intestine, and it can cause some dizziness, some lightheaded, and some diarrhea. Nowadays, our nutrition team and our bariatric team is very well versed at making the dietary and lifestyle changes to help with dumping syndrome, and that's successful about 75 to 80% of the time. However, if it's not successful for a small percentage of patients, there are endoscopic revisional operations that we offer here to help slow down the transit into the small bowel.
Well, thanks for all that info. I'd love to make an executive decision and say we're going to continue for the next hour, but I can't. So thank you all. We've included some tools for you at the end of this presentation. Thank you all for joining us. And thank you to our panelists for sharing such vital information. That was awesome. I hope this hour helps you to successfully manage your workforce. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on August 11th. We'll be covering trends and hidden costs of mental health. This session will equip you with strategies, resources, and services to address your employees' mental health needs. I hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you and have a good afternoon.